Hi, my name is Suzanne, and I delivered my baby at Penn Princeton Medical Center. So I've been married 2 years, and we decided that it was time to start thinking about having a baby. So I was basically having a normal pregnancy, and then came COVID. I thought maybe it would last a month or two. I wouldn't have to worry about it when I gave birth, but that didn't happen. I was very concerned. I didn't know what that meant for us and what it meant for the baby. It's such a scary time, but Dr. Michael Resnick, he has been the best doctor I've ever had.
We know that the COVID has had a great impact on our patients and the community here, and we have taken a number of precautions within our practice to keep our patients safe.
Dr. Resnick's office was great. They told me what appointments were necessary to come to, other ones we could do telehealth visits. They kept the waiting room so you weren't sitting on top of each other. They kept me up to date on their procedures in the office, but also the procedures that they were taking at the hospital.
A couple of days prior to a known admission, the patient is actually being tested for COVID. We also have implemented a policy where patients' partners are really the only people that are being allowed into the hospital.
He just made me feel more at ease about everything. During COVID, I've been the type of person that Lysol is my Lysol container. So I was really nervous going into it, and I would have to say, after I got screened for the symptoms when I first went in, I didn't think about COVID once during my entire hospital stay. They were definitely staying on top of keeping everything sanitized.
We have taken extra precautions in taking care of our patients, making sure your experience is a great experience and it is in a safe and well-cared environment. With this pandemic, we now have all this gear on top of us. We try to let the patients know that although we do have a mask and they can't see us, we are smiling underneath this mask.
Dr. Resnick was in there and other staff members that were just great. We went over questions. They just put me in such a calm state. My husband was able to come into the room and we had a baby. When they placed my daughter in my arms for the first time, I was amazed that that person was inside of me at one point, and now she was on the outside, and it was just a magical moment because we already had a bond, but I could actually see her. And from that moment, the baby never left our sight, which was very important because, especially with COVID, I was nervous about them taking her into other places.
After delivery, Suzanne went to a single room where there were no other patients. This also helps to minimize any chance of infection.
So I think I asked every single nurse there to come home with me while we were there. The nursing staff asked if we needed anything, if we need help with anything, if we had questions.
We start preparing our patients for discharge the moment they walk in. We want to make sure that they are comfortable and prepared when we send them home with their newborn.
I was still terrified, but I felt confident that they gave me the tools that I needed to be able to go home and feel like everything was okay. We are about 9 weeks out now, and she is great. She sleeps all the time. I couldn't have asked for a better baby, knock on wood. I couldn't recommend the hospital or Dr. Resnick's office anymore. They have all been amazing.
It's always a joy to work with a couple, and at the end of that 9-month period, to deliver them a baby. There's no greater joy in my professional life.
As many years have I done this, there are many times that I still cry. It's a magical moment, it's a miracle, and I will continue to do this as long as I can.
I know that when it's time for number 2, not anytime soon, that we'll be going back with Dr. Resnick and Penn Princeton.